Hello everyone, I am Dr. Simran Jetwani, the Growth and Marketing Specialist at the Founder's Office of Odigio Careers. And I welcome you all to the third episode of Non-Clinical Jobs Decoded. And today we have one of our successfully placed past clients, Dr. Sukalpa Rathore, with us to give us insights about her journey of transitioning from a forensic odontologist to a forensic business manager. And I won't be able to do much justice to her profile, so I'd ask her to introduce herself. So, yes, could you please introduce yourself to our audience?
Thank you so much, Simran, for that generous introduction, first of all. Hello, everyone. Hello to Odigio's audience. I'm Dr. Sukalpa Rathore, as Simran already has introduced me. Yes, so I am a forensic odontologist, but before that, of course, I am a dentist. And I've recently started working as a forensic business manager that Odigio actually helped me get into. So, yes, that's basically my gist, the gist of my professional profile.
Okay, great. So, ma'am, could you please give us some insights about your journey of transitioning from a dental surgeon to this forensic business manager role?
So my journey actually started in peak COVID era. It was back in March 2020. That was exactly when my internship had ended after BDS. So yeah, I was at home and I was already in a dilemma about what to do next because I knew for sure that I did not want to go for MDS, and all the clinics had closed. And so yeah, I started doing my research about what to do next, and I had always been interested in forensic sciences. So I started researching about it more. And yeah, that is how I found forensic odontology and decided to give the entrance exam for National Forensic Sciences University. And yeah, that is how I got into the university in 2021. And I started my post graduation. So my post graduation ended in February of 2023. And I was again back to where I was 2 years back because unfortunately, even in forensics, the job opportunities in our country are very less, and you really don't have a guidance as to what to do next after you have graduated. So yeah, I was back to where I had started, and um, yeah, desperate times call for desperate measures. And even though I didn't want to start practicing at a clinic, I did join a clinic, but simultaneously, I was also looking at other options. And yeah, that is when I found Odigio and I started looking at non-clinical job options. And fortunately, in October of 2023, I found this job opportunity at Virtual Autopsy Solutions, where I'm currently working for a forensic business manager role. And yeah, I mean, I thought that I perfectly fit the job profile, but I still wasn't sure as to what the job entailed because the role was very new. I had never heard of it before, of course. I mean, I knew what forensic odontology was, but yeah, I didn't know anything about a forensic business manager role. But yeah, I decided to apply for it, and fortunately, I got the job, and that is how I ended up here. Basically, that was my journey.
Yeah. So, like, yes, as you said, everyone while COVID, we all were in a dilemma, like what next and how would we proceed? Because
Yeah,
no one knew how would it actually work. Like even being dentist,
yeah,
we had no options like working from home and stuff like that. Unless and until we don't go to
exactly.
this hospital and clinic, we had nothing to do. So yeah,
Yeah,
like
exactly.
everyone could relate to this. Like back then, COVID was a stuff for everyone. So
Yeah,
yeah.
that's true.
Yeah. So like moving forward, what does a like for a forensic business manager role look like? What are the roles and responsibilities in your day-to-day routine?
Okay, so I mean, as I already said, this is a very new and a very unconventional role. So I am required to take on various job opportunities as they come. Because we are just setting up in India. This is a UK-based company, and we are just, starting our projects here in India. So I am required to do whatever I need to do to, drive the growth of our business and to promote our technology. So mainly, currently, my responsibilities are conducting online as well as offline seminars and workshops for healthcare professionals. So what we do is we conduct these seminars uh, in medical colleges, dental colleges, for healthcare professionals, and we train them in the virtual autopsy technology. So that is the stage that we're at. And hopefully by next year, our project is actually going to start in Bangalore. We are actually in the process of developing a center in Bangalore. So yeah, more things will be coming up. So currently that is where we are. We are basically educators for healthcare professionals.
Like in short, you're trying to like you're trying to expand in that sector, like especially in India because the scope is really
Yes.
saturated. Okay, got it. So
Yes, yes.
uh,
And we're basically promoting this, sorry to interrupt. We're
no,
basically
no, no.
promoting this technology because a lot of people still don't know about virtual autopsy because it's so new. Even the doctors,
Yeah, right.
we conduct these seminars, and a lot of doctors are actually, surprised that, oh, how you can actually do virtual autopsies now. So yeah, so that is where we're at. So we're just trying to create more awareness, and impart knowledge among healthcare professionals, and yeah, basically get them ready for when we actually start full-fledged.
Mm-hmm. Might be this sounds interesting to me. Might be I'll get in touch for the same.
Oh, for sure. We'll be lucky to
Because
have
this
you.
you. Okay. So, what, like, if you could just let us know what skills actually are required for someone looking or aspiring into this field.
Yeah, sure. So this is a very technique sensitive and a very knowledge specific role. So you need to have a forensic background. But yes, as we expand, we will have other roles. We will need people from the IT sector with us. But yes, currently we are mainly looking for people who have a forensic background, so that they can educate healthcare professionals, as I mentioned. So yes,
Mm-hmm.
you need to have a forensic degree. It can be a forensic odontology degree or a forensic science degree because we are working in both the
Mm-hmm.
sectors, forensic sciences as well as forensic odontology. And of course, if you have some skills in managerial roles, that is just a cherry on top.
Area.
So yes, that is basically the very basic qualifications that are required.
Okay. Okay. And moving forward to like get some more insights into your role, how do you try communicating about the complex findings to the non-technical stakeholders?
Okay, so if I have to explain to somebody what I really do, it's still very difficult because I have to start from scratch because this is so new. But yes, I mainly say that we are trying to aid conventional autopsies using digital technology because
Mm-hmm.
everything is so digitized today. So that is what I say that this is the era of digitization. So we are actually bringing the digitization to the forensic world as well. So yeah, that is how I would explain it. And yeah, we are not actually trying to replace anything because I don't think you can replace any medical practice that already exists, but we are
Mm-hmm.
only trying to aid it. So to make
Yeah.
it easier and to make it faster, more accessible. So yes, that is how I would explain.
Oh, great. So also when we like think about communication, how do you try guiding the other team members who like work under you in the domain?
Okay, so currently we are a very small team. We don't
Mm-hmm.
have a lot of employees, so we are a very, I would say, a tight-knit group. So communication is actually easier
Easier.
because the points of contacts are very less. So we can actually have a meeting and discuss everything that we are required to do. So yeah, we actually work as a team. There is no, I mean, I do have bosses, but whenever there's a meeting, we actually all work together. And yes, I'm not I mean, wherever I am meant to guide somebody, for example, if I'm meant to guide another healthcare professional who is new to this field or is new to this technology, yeah, I just, start from scratch. I just tell them, you know, um of course, they already know about conventional autopsy and they already know about CT scans. So I just, try to interlink both of these things and yeah, I just try to explain them. Yeah, so that is basically it.
Okay, understood. So also, like you did pursue a degree for forensic odontology, I do get it. But then, did you opt for any other internships other than that to like upskill or to like put some material into your resume, basically? So yeah, did you do
Yes,
something like that?
yes, so not specifically for, well, when I was doing my post-graduation, I did do an internship with Forensic Science Laboratory in Ahmedabad. So yes, I think that did prepare me to actually
Hmm.
start working in this field because you need some kind of experience in the, even though it was a very short stint, but yeah, you do need some kind of experience in the field to actually understand how things work. So yes, that was sort of my introduction to how things are done in the field. But other than that, to get myself ready for managerial role, while I was working as an associate dentist, I did take on some additional responsibilities because I was also doing clinic management. I was
Hmm.
implementing a lot of practices that would actually bring more patients in. I was, promoting the clinic on social media because their social media was completely inactive. It was non-existent. But yeah, when I joined, I actually took the initiative to, start these things. And yeah, it was actually appreciated, which I was very glad about because you need people who, keep motivating you. And, you need some kind of incentives to actually keep you going. So, yes, I was
True.
grateful for that. So I think these things actually prepared me for this managerial role. Other than that, I did not do any paid courses or anything like
Hmm.
that. But yes, I do believe that, in every role that you take on, I think you should always try to keep upskilling yourself because that is
Yeah.
definitely preparing you for something else. Yeah, that is um, basically what I did.
Yeah. So that's what when we like I personally am trying to transitional from the clinical sector to the non-clinical domain now. So sometimes even I think
Right,
what are those extra skills I need to put in the like to like to make it stand out from the others, make my resume
right.
stand out from others. But we don't realize we already do so much into our clinics, be it management, be it
That's true.
handling a team already. Like no one makes
Yeah,
us like into that realization, but then after a point we know this is the
yeah,
foundation we have to like
yeah.
transfer it into the
Yeah.
domain.
Yeah, you actually brought up a very good point. You mentioned handling a team. So what we don't realize, even us as dentists, we actually don't realize that we have these managerial capacities in us, because we are managing all these teams at our clinics. Because there's so many people working at a clinic, especially if it's a big setup. And we are actually, if you're working as an associate dentist there, you are required to manage all these people, even train new, people who are hired. So yeah, I think we are already getting these skills somehow, but we just don't realize.
We don't realize it because there's no one putting in light on this. Just because now we are transitioning from non-clinical to the non-clinical domain, we get to realize, okay, we have these skills too. Like we can be putting
Yeah.
these on table. What are the two interesting parts of your job role?
Oh, I think the most interesting part for me is just forensics itself. I know this is very cliche sounding, but I always wanted to work in something. I mean, even before I did dentistry or forensic odontology, I think I always wanted to do something different. I did not want to follow the in Hindi we call it bhed chal
Traditional part.
and rat race. Yeah, yeah. So, yeah, I never wanted to follow that. So, but more than that, I was always interested in forensics. And even when I was looking at non-clinical roles, nothing really stood out for me like forensic roles did. But the only problem was that there were no jobs in forensics. So, yeah, I think the most interesting part is that I get to work in the forensic field while also working a non-clinical job in a managerial role because I think I enjoy the management part of it equally. So yeah, I think that is the first most important thing. So for anyone out there who is interested in forensics, this is obviously going to be a very good option if and when this actually does, get its foundation in India. And secondly, I think this is Mm, to me, this is interesting because I do not have a very conventional 9 to 5 job. Like, I don't go to an office every day. I don't sit there in front of a computer
Mhm.
from 9 to 5. I am required to take on responsibilities as they come. I am required to talk to people, different kinds of people from different, sectors. So I think that is another interesting thing to me and also a very surprising thing because I never actually thought that I am a people person. I mean, I'm kind of a homebody. I don't like to, interact with people a lot. But, when I started working in this role, I actually started enjoying it. So, yeah, I think networking, you can say, is another very interesting thing that, yeah, that's very interesting to me.
This is what, because you like doing forensics, you are liking everything about it. Like, this is what
Yeah,
we say, like, do what you like, so you like everything related to it. Might be that is
exactly.
happening to you.
Yeah, I mean, it is challenging. I'm not like I am not going to sugarcoat anything. It is challenging because it's so new and it's everything is saturated, just like any other job. Forensics is saturated. We are still trying to. We are working very hard to make a lot of progress. Hopefully next year. But yes, in the middle of all those challenges, I am enjoying making something from scratch basically. So yes, I think that is very exciting.
It is interesting. Trust me, it is. I genuinely will contact you after this.
Please do. I mean, we would love to have you as our growth and marketing strategist. I mean, I'm not trying to take you away from Anayata, but yes, we would be
No,
lucky.
I won't be leaving Anaita, but I'll be doing both the roles, right?
Oh yes, definitely. That's even better.
Okay. So, like, yes, when we are talking about interesting parts, we should also always be talking about the challenging parts too. So, what are two
Yeah.
challenging parts, or what are the challenging parts you face in your day-to-day routine of this role?
So the biggest challenge is basically bringing this technology in the market
Hmm.
and building a business from scratch because yes, we are. I mean, this technology is already flourishing in UK and other countries, but in India we are still in a stage where we are very hesitant to new technology. I
Hmm.
mean, I used to think that Indians are actually very welcoming, but after getting into this business, I'm realizing that people are still a bit hesitant. They like to stick to their, old
Traditional
ways
parts.
and conventional ways. Yeah. So, I mean, that is definitely the biggest challenge. We are still trying to find our footing. But yes, we there is progress, slow and steady. But yes, there is progress every day and we are also conducting, funded researches to promote this, among people. So yes, I think that is the biggest challenge that we are facing currently. But yes, it's not. I'm sure that we can overcome this very soon. Yeah.
Surely. I do believe that.
Yeah.
Okay. So, also, could you like just put some light on what is the scope of growth in this field, like the forensic business manager role? How is the scope of growth?
Yeah. I think the scope of growth. is really good, mainly because there is not a lot of saturation. Because
Hmm.
in all the other roles in India, everywhere you see there's so much saturation, be it medical jobs, be it IT jobs, everything is saturated. Dentistry, though, very well how saturated it is. So, yeah, I think that is why this has so much potential and so much scope of growth, because I know how many people are interested in forensics. I
Hmm.
actually got so many questions from my juniors about this field, about this role. So I know there are so many people interested out there. We just need to, open up opportunities for them. And yeah, because, you know, sure, there is passion, there is interest, there is everything, but, these things don't pay the rent. They don't pay the bills. So you need to, come up with jobs for these young people so that they can actually fulfill their, dreams of becoming a forensic expert. So yes, there is definitely a lot of growth in this role, and I hope that we get to build a lot of opportunities for other people in the coming years. Yeah, so that everyone who's interested can actually get into these kind of roles.
Okay. Yeah, right. Because yeah, we actually, I am currently seeing so many people not following the traditional paths and thinking out of the box due to various
Yeah,
reasons. May it be financial stability, may it be work-life balance, or whatsoever. But then there are people who are trying to switch, who are trying to balance out things. So past then, when we see, we didn't even know these options actually exist. Now people are trying to
yeah,
get it.
it's true.
So that
It's
is
true.
a nicer thing for, like, yeah, everyone should grow in life. Why not?
Yeah, even I didn't know until last year that a role like this existed. I only knew, okay, there is forensic scientist, there's this. But yeah, it's even to me this is very new. So yes, I get it.
Right. So, could you recommend people to take up career in this role? You-
I would, but I would also say this does come with a disclaimer. Uh, I would suggest that only go for this role, especially specifically for this course, because you will need to pursue a forensic science degree. Only if you're really passionate about it, only if you're ready to put in, um, sorry, only if you're ready to put in a lot of time and effort into this field, because it is demanding, and you will need to stand out in the crowd. You will need to put in an extra effort so that you don't get lost in the crowd. So yes, only if you're really interested in pursuing forensics or in any way. I'm not just talking about forensic business manager, but even forensic science roles. Only go for it if you're really interested and you know for sure that that is where you want to be. So yeah, I would definitely say there are a lot of opportunities. You might need to pave your own way somewhere along the line. But yes, that will only happen if you're motivated enough and if you have a lot of passion for this field. So yes, I would encourage people to take this up if they're interested.
but this was a great piece of advice. Like, we should not be like just going for something because everyone is going. But yeah, unless and until we are
Exactly.
actually interested into it, that makes
Yeah,
like that
that's
only
true.
makes sense. Yeah, I
Yeah.
like that. People should like try making some pointers out of this.
Definitely.
Okay, so we'll move forward and if not forensic business manager, what other roles were you interested in back then when you were applying for jobs?
Yes, so as I mentioned, I was when I was working as an associate dentist, and I started, dipping my feet into the managerial roles. I did realize that I enjoyed the management, part of the job. So I was looking into, business manager roles in healthcare fields. So even when I started proactively, looking up jobs on LinkedIn, I was looking at a lot of business manager roles. So yes, I would say I even applied to a lot of business manager roles in healthcare companies. So yeah, I think that was my second option. If I did not get a forensic manager role, I would have definitely ended up in business management or something like that.
Then you were always interested in business management things. Like you only
Yes.
wanted something into this business management. Okay.
Yeah.
You
And this
actually
I
got
only realized
clarity about
last
this.
year. Yeah.
Sorry,
This I
sorry.
only realized last year. I didn't know this about myself before that. I only started, realizing it when I started working at the clinic, that I did not enjoy the clinical part of the job as much. But yes, the managerial part I did.
Yeah. So like yes, you had clarity about this. That's why it was a easier, I wouldn't say easier, but then like you were okay with it because
Yeah.
most of us, I would say sometimes even now when I think about myself also, I get into a dilemma. Like, do I want to get
Mm.
into this or not get into this?
Yeah.
Sometimes that happens. So, yeah.
Yeah. I mean, I was actually considering MBA for a bit, but
Mhm.
then I realized, oh, I'll have to study maths again. So that was actually a huge no for me. So I decided that, I'm going to try to upskill myself. I cannot do CAT, man. I don't think I can do CAT. So
I
yeah, I
can
think
feel
I
you on
always,
this.
yeah.
I com So, coming to the end of our segment, I would like to ask you a last question and like, could you please tell us how did you land into this role?
Okay, so basically, I started looking at non-clinical jobs in 2023 while I was still working as an associate dentist at a private dental clinic. And in I think October 2023, on I saw this job opportunity on LinkedIn, and I was already, actively networking with people on LinkedIn and applying to jobs. And fortunately, I saw this job opportunity that was perfectly, matching what I had been looking for, something in forensics and, business management. So I decided to apply for it, even though I was a bit nervous because I wasn't sure about the management part of the role. But yes, it did, ask for a forensic odontology qualification. So I decided to apply for it. And yeah, I just gave the interview. It was a two-part interview. And over a span of, 1 month, it took 1 month for them to get back to me. And yeah, I think in March 2024, I finally got the news that, I had landed it. So yeah, that is basically how I ended up in this job. I mean, of course, it sounds very short and sweet when I tell it like this, but yeah, it was a very long journey of ending up here after working at a job, at a clinical job that I did not want to be in. Yeah, so yeah, basically that was the gist of how I ended up here. I got in touch with Anayata, I think in August of 2023. And yeah, she helped me with my resume, with networking, with my cover letter. And yeah, she was so helpful. Like, even when, even before, talking to her and taking her consult, the call, I was a bit nervous because, I didn't know what it was going to be like. I didn't want
Mhm.
somebody to just, tell me that, oh, do this, do that. But she was very friendly and warm. And I think the one thing that really helped was that she had gone through most of it herself. She was a struggling dentist once, and then she, carved out a path for herself. And so she knew what I was going through. And she, guided me through the whole process very gently. And I had so many doubts, and I used to bombard her with questions. Every time I would apply for a role and not get a call back, or, give an interview and not get a call back, I would just get so frustrated. And then I would just bombard her with questions like, what am I doing wrong? What am I not doing? But she was always so patient with me. Yeah, so I think obviously a huge credit goes to Ananta and Odigio for helping me land this job. And yeah, I mean, basically, those were the skills that I learned through this journey from Anayata that actually helped me crack this interview. So yes, Odigio has a huge hand in me getting this job.
Okay. Thank you for your words. But then, yes, moving to the most interesting parts. I like this one because we have started this one to
I don't like this at
buckle
all.
up.
I am getting a viva feeling,
No, no.
and I'm very
This
bad
will
at
be a
that
fun
one.
session. No, no. This will be a fun
Okay,
session. Nothing
okay,
like more complex into it. Very fun segment, and I only
okay,
require and I only want you to be spontaneous. That's it.
okay,
The
okay.
first thing
I
comes
will
in your
try my
mind should
best.
be the answer. Okay.
Oh, I hope it's not just some food because that's basically on my mind all the time. But okay.
Okay. So yes, we'll start with it. And your first question would be clinical or non-clinical.
Non-clinical.
Okay. Where do you find a good work-life balance? Like clinical
In
or
my
non-clinical? No, no, clinical or
non-clinical,
non-clinical. Okay. So,
non-clinical for sure.
okay. And where do you find more financial stability?
Non-clinical, hands down.
Okay. Clinics or corporate office?
Corporate office.
Okay.
Since I have to give just one answer, yes, corporate office.
Okay. Clinical rounds or client meetings?
Oh man, client. I'm not a fan of either, but client meetings because I like non-clinical now.
Okay. Where do you find more flexibility?
Non-clinical for sure.
What is the most challenging part? Patient care or tight deadlines?
Patient care.
It is? Okay.
Yes, patient care. You're dealing with
Why?
a human being in pain. Sorry, I won't say anything.
No, no, no. You can continue. Please, please.
Yeah, I mean, you're dealing with a human being who's already frustrated, who's already in pain, and yeah, so I think I still find that more challenging. But yeah,
But
other
that
than
is
that,
interesting too. Like many people do find that interesting too. It depends
yeah,
on obviously person to person.
yeah, true.
Okay. Uh, also, okay. White coats or formals?
White coats. It's white coats have my heart. I mean, yeah, white coats.
Fixed shifts or flexible hours?
I think I prefer fixed shift.
Okay. You find discipline more of your thing? Is it like that?
I
Is
think,
it that
yeah,
way?
yeah. I mean, yes,
Okay.
because I am not a very disciplined person. So if I have flexible hours, I tend to procrastinate a lot. So I think
Okay.
fixed shifts work better for me.
Okay. Where do you find more of a job stability?
Non-clinical jobs, 100%.
More growth opportunities, clinics or non-clinics?
Non-clinical.
Okay. And coming to your segment, what is your favorite part about forensic business management?
Forensic sciences, everything that has to do with forensics, everything that has to do with, you know, human identification, but also the management part.
In short, you love anything and everything about forensics. We can say it that
Yes,
way.
yes.
Okay. How do you manage high pressure deadlines?
I just, I actually am a person who actually thrives under pressure. This is a very interview wala answer, but yes, I do find that I work better when I have, when I am under pressure. So yes, I think I work okay. Even if I'm stressed, I manage to get things done. So yeah, I just, roll with it, you can say.
This is a rare quality. People usually freak out when they have tight deadlines.
I am freaking out, but somehow that motivates me to work better or harder.
Keep
I don't
working.
know how. Yeah.
Okay. Uh, Next would be what is your go-to tool for managing like forensic investigations?
My go-to tool. Oh man. I don't
Mm-mm.
think CID would be a good answer. I know this is not very rapid fire, but I can't think
No,
of an
that is
answer.
okay. इतना cheating चलता है.
My go-to tool for forensic investigations. But well, that's a tough one actually. Oh man, I don't know. What is my go-to
First thing
tool?
in your mind, nothing.
The first thing that came to my mind was CID, unfortunately. I think the reason is because it's such a broad answer. I don't know what to say. I think just curiosity. Just curiosity to find out, anything, any clue. So yeah, curiosity.
Okay.
Mhm.
So, risk management or damage control? Like, what is tougher?
Oh, what is tougher? I think damage control because the damage is already done and now you have to control it. You have to
Oh,
get
you have
back
to
what is
band-aid
destroyed.
it.
Yeah.
Right.
Yeah.
Okay. How do you keep up with evolving forensic techniques?
Oh, just keep reading, keep researching, keep yourself updated, keep reading new research articles that come out. That is what I do.
Okay, understood. What is the best advice you have received in your career so far?
Oh, mm. Oh my God. So the one thing that's coming to my mind right now, weirdly, is actually one of my professors during BDS. He was
Mm-hmm.
also like a friend to all the students. So he said one thing during my college. He said, "Keep your head down, come unnoticed, go unnoticed." And I know this may not be a very ideal advice for everyone,
Mm-hmm.
but what basically he meant to say was, don't think about, you know, getting everyone's attention. Just focus on what you're doing and just keep your head down and, don't get involved in things that, you're not meant to get involved in. So yeah, I think that was actually the one advice that got me through my college years because it was, sometimes a very stressful time, even though college is supposed to be fun and all that, but yeah, I mean, BDS is very stressful at times. So yeah, I think that is something that really helped me. I just tried to keep my head down, focus on what I was doing, and yeah, I just basically did my job and got out of there and continued doing what I wanted to do.
Yeah, actually, it is a great piece of advice. Like, if we just keep our head down and we are good to like focusing on things which are actually important rather than getting involved
Yeah,
into 10 other things which we actually don't need to.
yeah,
Yeah, so
exactly.
that is, I liked it. I'll keep that in my mind maybe.
Sure.
Okay. So, what is that one skill every forensic business manager should excel in?
I would again say curiosity, because if you're not curious enough,
True.
if you're not curious enough to keep looking for clues, I don't think you can
Mhm.
be a good forensic expert. So yeah, curiosity is key.
True. True, true. Makes sense.
Mhm.
What is the biggest trend in forensic business management?
Oh, biggest trend. Not in forensic business management, but in business management roles in general, I think social media is now a huge thing. So everything, like even we are trying to promote everything on social media. So yeah, I think everyone just needs to become a social media influencer at this point and just try to promote themselves or their companies on
Yeah.
social media. So yeah, I would
Yeah.
say social media.
It is like becoming a world of digitalization. We
Yes.
can say that. It is true. Yeah.
Yeah.
How would you approach training team members? Like you did answer to this, but then again, if you like want to do it in short.
Well, again, I would start with the ABCs. I would start with, the very basics. Start with what actually autopsy is, what all entails, and then
Mm.
slowly move on to what virtual autopsy is, and try to associate the two worlds, the non-digital and the digital worlds together. So yeah, just start with basics. basically.
Yeah.
Which most of them are already aware of because they are medical professionals. But yeah,
Hmm.
basically just brush them up on what they already know.
Yeah, to brushing up the things, in short.
Yeah, yeah,
Yeah,
basically.
understood completely. Yeah. Uh, last. This is the last,
Mm.
but then yes, one of your favorite cases. If you could just
Well,
tell
sorry,
some
one of my favorite.
cases, like forensic case, if you.
Ah, forensic cases. Well, this is not a case that, I was involved with in any way, but since this is rapid fire, this is the first thing came to my mind. This is a very key case that is responsible for me becoming a forensic odontologist. So the Nirbhaya case, actually, so two of the human identifications, were actually done because of forensic odontology, and that was the first time actually when I heard about Dr. Rashid Acharya, who was the forensic odontologist that did the identification, and that is how I sort of got introduced to how forensic odontology is actually, it can make a difference. And this was back in college when I was still doing BDS. So yeah, that case still, I mean, of course there are other reasons why it stands out, but yes, it for me personally, that is the reason why it stands out, because that is what got me into this, because I think it was a benchmark case uh, in every way for our country, for forensic sciences, for forensic odontology. So yeah, that is the one case that still stands out to me.
Great answer. I love this one. I love the answer.
Thank you.
Oh,
Thank
yes.
you.
We are done with this, and thank you for doing this with us. From your busy
Thank
schedule, like not being okay health-wise, and still you are here doing this with us. We are grateful for this. We are
So
actually.
thank you so much for having me, Simran. I mean, I know I had postponed it a couple of times, but yeah, I mean, getting to do this is my honor. And yeah, thank you for having me. I had so much fun, even though I was a little nervous about the rapid fire. I had a lot of fun. Thank you.
Rapid fire was fun. Rapid fire was actually fun. You were great.
Yay, I did well.
Yes, you did it.
Thank you
Okay.
so much.
Yes. Thank you so much. It was great having you. And
Thank you
people
so
would
much.
love, like, people would get some really great insights into the forensic field from this one.
Yeah,
We are
I
hoping
really
for
hope
that.
so. And I hope to meet a lot more forensic, experts and forensic enthusiasts in the future.
Surely. Okay. Yeah.